Welcome again. Another video discussing the appearance of restorative materials in the radiograph, and in this periapical radiograph of a lower lateral, lower canine, lower first premolar, lower second premolar, we will also see a number of restorative materials that have been used in these teeth. Basically, start with all the 4 teeth which are shown in this radiograph have been root canal filled with a gutta percha, but the coronal part of the roots or the crowns have been treated differently. Starting from the lateral, lower lateral, we will see that this root canal filled tooth, this is gutta percha, and the tooth has been restored with a post and crown, and this is a cast post, so it is not a prefabricated post, so it's a casting. Of course, this is casting metal, cast metal, and you can see that the gutta percha which is present here, of course, naturally it should be removed, leaving the lower third of the root of the filling left, and 2/3 of the root canal filling is removed to give space for the post and the core, the metal core. Okay. And of course, this has the core part has been covered with that is porcelain fused to a metal, and the metal here, of course, is a cast metal. The other tooth, which is the canine, also has been root canal filled, and this is the gutta percha. And the pulp chamber has been filled with the gutta percha as well. How do we know this? We know it from the radio opacity of the root canal filling, or the part of the gutta percha which is present in the root canal, and the part which is present in the pulp chamber. And the mesial cavity has been closed by a composite filling. We can see that the composite and the gutta percha here, they look more or less of the same radio opacity. If we go to the lower 4, this which is also root canal filled, this is the gutta percha, and the crown of the tooth has been restored with an onlay. The onlay porcelain, of course, because if you compare the radio opacity of the porcelain, if you compare it to the radio opacity of the gutta percha, it's more. How do we know that this is an onlay? Because this part hasn't. If it was a full porcelain crown, then we don't see this difference between the occlusal part and the mesial part of the root. If it was a total crown replacement, then we would have seen that the radio opacity here is all the same. So this is an onlay that has been used to restore the crown. If we go to the lower 4, again, a post and core has been used to restore this tooth. Unfortunately, that only this part of the gutta percha is remaining. This part of this missing part of the gutta percha of the root canal filling seems to have been removed while removing the coronal 2/3 of the crown, and there was no attempt to restore it back. So the post, this is the post, and the core, this is the full metal core. Compare the full metal core to the PFM. You can see here that the radio opacity of the crown is all the same. There is no portion of a material that has a lower radio opacity if you compare it to this one. So this is a full metal post and core. This is a PFM, porcelain fused to the post and core material. So PFM, porcelain, metal, the metal core, which is of the same radio opacity, and gutta percha. Composite, gutta percha extending all the way down to the apex. Onlay and root canal filling, and this is a full metal crown, post and core, all of the same radio opacity with gutta percha filling.